Thank you for joining us. If you're joining us on your lunch hour, I appreciate you taking the time to sit with us for our first webinar Wednesday of 2019. Very exciting. So today's presentation is going to be a little bit different from what we've done in the past. We will be doing an exclusive demonstration of our communication suite today. So pretty cool. We'll talk through sort of the subject matter for today, and then we'll hop into the actual Updox platform and show you exactly how we see benefit to use our platform. So let's get started. So our discussion today is going to be over improving collaboration with clear and compliant communication. So Updox helps you and your practice alleviate the burden of the administrative chaos, so streamlining the communication flowing in and out of your practice. So we hear a lot about physician burnout in today's healthcare landscape, how you're stressed out, how all of the regulations coming down on you really make your day a little bit more stressful, and it takes quite the effect on you and your staff. What is oftentimes left out of a lot of the physician burnout articles is the ongoing exhaustion, not only on providers in the practice, but the staff as well. So as the healthcare landscape changes, physicians are spending more and more time on non-clinical paperwork to counteract the growing number of daily tasks, while your staff is focused on the other administrative duties in your practice. Over 36% of office managers actually cite burnout as a huge problem for themselves and for the other staff in your office. So we're going to talk to the burnout points as well as just generally how you can try to start streamlining the process within your practice to help kind of counteract this burnout effect. So in a recent survey that we collected, 63% of those surveyed cited administrator as their title. We asked these survey participants to rank a series of common practice problems from the least important to the most important that they see on a daily basis. The following were ranked the top 5 out of 30 options. First, the top was improving staff satisfaction. This is a primary action item for the office managers within your practice. So really improving the day-to-day workflow of your practice staff and increasing that staff morale. Number 2 was improving staff productivity. Obviously, you have a lot going on in your practice on a day-to-day basis. So increasing the efficiency around your practice and making sure that those workflows are running as seamlessly as possible and increasing that productivity is another vital action item on the office manager's list. Number 3 was eliminating the need for manual tools. So whether that be a fax machine, whether that be the phone kind of connected to your shoulder at all times, kind of limiting the need for having to do this redundant work. Number 4 was empowering your patients in their healthcare. So really making your patients a team player when it comes to their care plan. And then the last one was reducing staff time on the phone. So burnout and general fatigue also leave a huge margin of error when it comes to the administrative tasks. So alongside all of these problems that we're talking about that are critical and really, really important to your office managers, we also have to think about the risks that are included when it comes to this fatigue and this burnout that sets in. Follow up among the care team, increasing staff productivity, improving staff satisfaction is already hard enough without the addition of burnout and fatigue on your staff and the providers at your practice. So maintaining fluid, organized, and trackable communication for internal and external communication can really help you build that streamlined process of administrative tasks. And historically in the healthcare, technology has truly been limited. And let's be real, it's clunky at best, especially with the items up on the screen. While reports say to implement technology and to maximize your EHR and the interoperability of your EHR, most physicians and their staff are pretty weary of the changes implicated with onboarding new technology. So the regulations set upon healthcare leave you at a disadvantage when it comes to picking out technology. You have to stay compliant. You have to take your EMR into consideration. You have to think about the learning curve and ramping up your staff from those other systems you're currently using. And with the current state of staff and physician fatigue and business costs coupled with the difficulty of ramping a business onto new technology, it may truly seem like a daunting task to change up what you're currently doing. But at Updox, we get it. As a platform built by physicians for physicians, we've really considered your needs at the forefront of what we build. So what does this mean exactly, and how can Updox help you? First of all, we help you consolidate your communication. All of your internal and external communication lives in a single HIPAA-compliant platform, fully integrated with your EMR. This workflow event is an exclusive chance to see exactly how Updox actually works for your business. Rather than just giving you an idea of how you could use it, we're going to show you exactly the workflows that we think are best fit for the size of your practice. And all of these workflows are also customizable to your practice. So dependent on how your daily structure runs, you can build these as such. We also help you organize. So whether it be a secure message coming in, an email, or a fax coming in and out of the office, your communication can be tagged and tasked accordingly based on practice preferences. And then we also provide a huge level of efficiency for you and your staff. You're leveraging a single platform to execute on administrative tasks that normally take up anywhere from 3 to 5 hours weekly. Again, we can help you improve connections with other providers. I will go into that a little bit more within the demonstration. And then overall, with all of these things considered, we can help you improve your staff morale, which was number one on office managers' most pained daily thought. So let's go ahead and jump into it. Let me talk you through this, guys. So the first thing we're going to talk through is just how all of the communication flowing in and out of your practice is consolidated into a single platform, what we call the collaboration hub. As you notice, different things are color-coded dependent on what they are. So all of your faxes, your secure emails, any uploads that you do, anything you print to Updox, secure messages from your internal staff, secure text messages, and we'll go into that a little bit more. All of these things are going to be filed and shown by color, making it very, very easy for you to kind of sort through and tag things as needed. This inbox is also 100% HIPAA compliant. So if you are using the fax machine, if you are sending out things in an unsecure way, whether you're emailing them to other practices or you're having to phone call after phone call, kind of track down providers as well as the pharmacies to make sure that you're communicating with the care team as fluidly as possible, it can be really, really hard and also unsecure. So what we provide is a platform where you can do all of those things without leaving the workflow that you're already using with your EHR. So let's just jump in here. The organization is what I'm going to go into second. And it's just really, really easy. So first things first, you can change the name of every document that comes into Updox. So if you wanted to start your own naming convention so that you can easily track things, super easy. You can tag it by patient names. You can tag it by what the document is. So if you wanted to name this lab results, you can do that. Doing so helps you organize things within the archive. So the archive is where we store all of your documentation for up to 21 years, actually. So within Updox, we keep everything safe for you within your admin tab. You go into your practice settings. If you see right down here, you can keep your items in the sent folder and you can pick your time frames, but we keep them in there for up to 7 years. But after that 7 years is up, we don't just delete items out of the inbox. We put them in the archive. If you are already archiving things, we'll keep it in the archive for 7 years. And then after that 7 years, we can put it in the trash where you can still access all of those files. So depending on what works best for your practice or how long you'd like to keep documentation, and if you want to go ahead and delete it, that's fine too. You can definitely get rid of it. Again, you can pick those time frames. But just to give you a little bit of peace of mind for what you're getting with Updox, As long as you're naming things in an easy way for your practice to find later, it's really, really easy to audit your documentation, to audit the things you're sending in and out of your practice, and also relocate them just in case. If another practice says you were supposed to send a patient CCDA file over to them and they didn't get it, you can easily track here in Updox whether or not you did send that out. You can do that within your sent files, or if you saved it in your archive, you can do it here. And if for some reason somebody trashed it, no worries, it will be safe within Updox. So that shows you a little bit how easily things are tracked. We also can help you organize in a very special way for as things come in. With our queues option, you're actually able to set up different queues or phone numbers. So if you have a little bit bigger of a practice, or you have different teams that might be set up around your practice, you can pick numbers for them, organize by team, and then set those faxes and documentation to come directly into those queues. So that if you have a front office staff that are typically triaging documents or leaving them on desks or sending them to the back or filing to the patient's charts, they can easily route things directly into these queues. We also have what we call tags. You get 39 customizable tags within Updox. This really just is a limitless option for you, as you can do it by priority. You can tag by doctor, as you see here. That's how we have it set up. We have DME orders, prior authorizations, referrals, to be signed. This is just a quick and easy way for you to make sure that you're seeing exactly what's pertinent to you as the provider or pertinent to you as an administrative staff member, making it very, very easy for you and your staff to kind of organize and stay on top of the documents that are the most important. The next thing I'm going to touch on is the efficiency of Updox. So with Updox, yes, you're able to compose, you're able to send things to other practices, anybody you're really faxing, secure messaging, or trying to send things out to. But what's really cool about Updox is that you're actually able to simultaneously execute on an action. So whether that is sending to a patient portal or sending to the EHR, you can do that. Or if you wanted to send a document, let me show you here, to another user and email that. And then if you wanted to also fax something over the same document, you can create the contact for them in your address book really easily from the same screen, or you can also just quickly send. With your cover sheets already in Updox, it makes it very, very easy. We also provide you with different templates. So if you're constantly sending referrals over and sending the same message but having to type it out every single time, you can customize a templated referral sheet that will send over directly with your message or a new patient registration. You can do that here. So what this allows you to do is execute on simultaneous actions in one screen, making it very, very easy and efficient for your staff. Rather than having to walk back and forth from the fax machine, answer the phone, try to track down the other practice you might be trying to get a hold of, you can do it all directly from Updox inbox. We also provide you with an address book that syncs directly with your EMR. So if you are already actively adding other providers and your patients to your address book, that will sync over when you get registered for Updox, making it really, really easy for you to kind of locate those people that you are sending a lot of things to on the regular. And then we also provide you something called the directory when you sign up for Updox. We are the second largest HISP in the nation, so you would have access to 1.5 million providers. So if you happen to be moving your practice to a separate location or trying to get in touch with providers that might be a little bit closer to your patient's new residence, you can definitely do that here. You can search by zip code, you can search by last name, you can search by phone number, you can search by name. So all of those will have access to that. As soon as you sign up for Updox, you have your address book and you have your directory. It looks like this demo space isn't actually connected to an EMR right now, so it's not going to show you exactly what it looks like, unfortunately. But we can absolutely show you that in a one-on-one demonstration as well. Along with the efficiency side of things, we also allow you a really easy editing tool. So you can drag and drop directly in, and that will show up red as an upload into your Updox account. So here we have it, Sean Connery's RX refill. So from there, you can actually edit the document. So there's no need to print, there's no need to scan back into the chart. You've got all of these options right here at your fingertips. So if you needed to add a quick note, you can erase if there are things on the document that you don't necessarily want the person you're sending to see. We've got check marks. All of these features making it super simple for you and your staff so that you're not having to do that redundant work or have that paper trail where you're having to print, edit, scan, or print, leave on somebody's desk, or chase down the provider for a signature. You can task directly in Updox so that they're able to see, oh, hey, I need to sign this. They can simply click their signature, save, leave you a quick secure message to let you know, hey, this is ready. And then you're able to just kind of move on with your workflow. So one quick other way to maintain connections with other providers, I wanted to show you a really cool thing that we offer called Refer and Share that a lot of practices don't often see necessarily. So Refer and Share is an easy and free way for you to connect with other providers directly within an Updox platform without them having to necessarily sign up for Updox. So with Refer and Share, you simply send an invitation. So you can do that by name or email address. Our founder, Dr. Andy Barbash, this is actually how he has built out his address book and really made those big and strong connections on a daily basis with other providers. He works at home doing telehealth business, so it's really important and vital for his business to stay connected with these other providers in an easy and fluid way. So this is how he does that. And you would just send the invitation. They would get registered for an Updox account, which looks very, very similar to this. But they're able to securely message with you here in yellow. That's unfortunately all they can do with Refer and Share unless they get signed up with Updox. But this just allows you to put them in your current workflow with secure messages and making it very seamless for you guys to connect back and forth. I think that's all I've got as far as demonstration goes. I'm going to leave it up for questions now as I go through the rest of the presentation. Just a quick quote here as I get those questions flowing through. Honestly, Updox is cheap and efficient. It has zero learning curve. So as I mentioned in the beginning of the presentation, a lot of times what kind of hinders you from getting set up with new technology is the fact that it's really difficult. There's a learning curve. Oftentimes you have to ramp up your entire staff. That's a lengthy process. With Updox, you are easily able to register and kind of self-service yourself getting set up with Updox. We offer free training and free support, making it, again, very, very simple for you and your staff to get set up. I also want to go over one really cool option we have now that's something very, very new to Updox customers, and you can actually access this whether you are an Updox customer or just an avid researcher of technology. We have something called the Learning Center that has just started within Updox, so I'll quickly jump back in here and show that to you. If you hover over this little light bulb here in the Updox application, if you are currently a customer of ours, it will open up this really, really great service that we have now called the Learning Center, where you are able to click into different videos and job aids that kind of walk you through step by step how to use Updox and how to use different features within Updox. So whether that be the faxing, how to configure your fax settings, creating your fax cover sheets, faxing the basics, you have access to all of these videos, visually stimulating and easy to watch, easy to see exactly how you do it step by step. But also coupled with these job aids, you can pass these around to your staff, making it extremely easy to get set up on Updox. Looks like we have a couple questions coming through, so I'm going to jump back into the presentation so I can show you guys how to get there. If you're not a current user of Updox, you'll have access to the Learning Center. I'll leave that link up here for you guys while I answer questions.